The symptoms of acid reflux are multiple and can vary from patient to patient. The most common are heartburn, so burning sensation in the chest, at the bottom of the chest, bitter taste in the mouth, acid brush, so some acid coming up in the mouth, sometimes regurgitation, which could be only liquid or sometimes even small amount of food. Patients sometimes they also complain of nausea and sometimes difficulty in swallowing. The symptoms might get worse after meals or overnight when patients are lying down or they're bending over in doing some of activities. One of the other common symptoms reported by people complaining about reflux is gas bloating, but this is usually associated more to bowel problems more than the reflux itself, but I can tell from experience that the two things are much related together. There are several anatomical mechanisms that prevent reflux itself and keep the stomach in the abdomen and the food pipe in the chest. If one of these mechanisms is not working properly, then the patient can experience reflux symptoms and heartburn, such as in the case of hiatus hernia, when the stomach, instead of being full in the abdomen, some of it is high in the chest. So the acid that is produced by the stomach can affect the food pipe. Other things that can not cause, but can trigger reflux symptoms are increased in the abdominal wall pressure, meaning such as during pregnancies or because patients have a high BMI, so the weight, they should lose a bit of weight, basically. They are overweight. Usually the first line treatment for reflux is a combination of lifestyle changes and medication, antacid medication in the form of proton pump inhibitors. Lifestyle changes includes stop smoking, avoiding all those type of foods that can trigger the symptoms, such as fatty food, alcohol, spicy food. Avoid to sleep completely flat, so raise the head of the bed, and avoid to have late evening meals. Or if people are going out to have a meal, wait at least 3 to 4 hours before lying down. Surgery is an option and usually give the best result in selected cases where there is a confirmed pathological acid reflux and when there is a good symptom correlation with acid reflux. And these two things are usually confirmed by specific tests and special tests that the patient will have to go through. As I said earlier on, this is mainly related to lifestyle changes. So what to avoid, food and stop smoking, losing weight if patients are overweight. There are also over-the-counter treatments that can be used in order to give a quick and short relief from acid reflux, but there are no magic potions that can, unfortunately, keep the reflux under control. So in a small percentage of cases, yes, it could. That's why symptoms that are lasting despite medications or that are associated to what we call the red flag symptoms, such as an important weight loss, warranty an investigation with an endoscopy to make sure that there is no underlying pathology that is causing the reflux and the patient's symptoms. So as I said earlier on, food might differ from patient to patient. What is notoriously associated with an increased acid production from the stomach are spicy food, fatty food, food that it stays in the stomach longer than usual, so it's more difficult to digest, coffee, sometimes chocolate, tomatoes, and orange juice. These are all the notorious stuff, but it might be triggering symptoms in one patient and not the other. So every patient should keep a sort of diary and what to avoid and what not in order to reduce the symptoms.